Friday. Let's see. I think we got a quorum. We don't have a lot to cover today, so I think I'll just go ahead and call the meeting to order and welcome everybody. Welcome to the staff, and we'll go ahead and run down the roster here to where we can help Connie take roll. So Mike Brower, Sarah,
Sorry, I'm here.
Robin,
Here.
Sandra,
Here.
Gary,
I'm here.
Jason,
Here.
Mike Kage, Mike's here. Lori, Monica,
Here.
and Keith. All right, you get all that, Connie?
Keith is excused. He could not make it to the meeting this morning.
Okay, thank you. We'll entertain a motion for passage of our last month's board meeting minutes.
This is Jason. So moved.
This is Rob. Second.
Any further discussion? Seeing none, all in favor of passing the minutes from last month's meeting? Aye.
Aye. Aye.
Aye.
Aye.
All opposed, same sign. Unanimous. Thank you. Now I'll turn the meeting over to Chris. Chris, any updates, information from the AG's office?
Hey everybody, thank you for letting me attend remote today. I got back from a work trip at 2 a.m. yesterday, so I'm a little groggy. There are no real major updates for the last month. The board asked us to look into how does KDOA and KDADS do grant making, and we have not been able to get information ready to share with the board yet, but we're working on that. Should hopefully have that done by next meeting. The other major issue that was outstanding was the subdivision report that is currently with our front office. I'm working to get that done as quick as possible. I recall I wanted to get that out by July 1st. Unfortunately, things just got delayed on our end. But I'm moving that to get that done as quick as we possibly can. In settlement news, the Kroger settlement is in the water with the subdivisions. They are currently working to sign on to that particular settlement. We don't have a current update on how many have signed on, but it appears that most everybody is just getting that paperwork taken care of. I'm certain I'll have an update for you on where that is next month, as the deadline to sign on will occur, I believe, the first week of August. Finally, you probably saw in the news that the Purdue bankruptcy was overturned by the Supreme Court. I'm going to be fairly limited in what I can say because Kansas does still have active litigation against Purdue. But what I will say is we are going to continue attempting to hold Purdue and the Sacklers liable for the conduct that they took to cause large parts of the opioid crisis. Beyond that, I can't really comment on where we're going from here. I'm open to any questions anybody has.
Questions for Chris? So with Purdue, Chris, that's probably going to drag on for a year or two.
I don't really have a great sense of a proper timeline. It could because the process is still in the bankruptcy, it could resolve theoretically quickly. It could take many years. Unfortunately, I really just don't, there's not a really good sense of what time that's going to take.
Okay, and would you, I'm asking you to handicap this, so it might not be fair, and you can say, I don't know, but so could we assume that the low bar is what the settlement offer was, and from here it would only get greater, or
We can't assume that. The bankruptcy previously included money from the Sacklers, but technically the only entities that have declared bankruptcy are the Purdue entities themselves. They have considerably less assets than what the Sacklers were contributing to that bankruptcy. The low bar is no longer what the previous bankruptcy resolution was. It could be all the way down to zero. We really don't know what that range is just yet, and that's partly because we're still so new after the Supreme Court's decision. A lot of that is part of our process of figuring out what our next steps are going to be.
thank you. Any other questions for Chris? Thank you for the update. And,
Mr. Chair, if I can, I would just remind everybody about what the range was on the Purdue settlement for Kansas. That was this was a very rough estimate, so don't take it as an exact dollar figure, but it was in the neighborhood of about $39 million over a period of time for Kansas. It was a substantial amount of money, but was not by comparison the same scale as some of the other settlements that we've been at. So we'll see when we get closer towards a resolution, if we can get to a resolution, I'll have more updates for you in the future.
thank you. Well, with that being said, thanks a lot, Chris. We'll move right into update from Krista and Alicia. So I don't know which one of you want to go first, but let's hop right in there.
Thanks, Pat. Krista here. I'll go ahead and start. Just updates on the status of RFP 3, which is currently open. That's the one that's focused on treatment, recovery, harm reduction, and linkages to care. We held the first webinar on June 26th, I believe it was. And we had 90 attendees. We had 143 registered for that. The webinar was recorded, and so that is now up on the Sunflower website, the recording along with the slides for anyone to view. And then we have, as of this morning, 73 confirmation of intents to apply. And then that closes end of day today. That, again, that's not a mandatory requirement, but that's something that we use to plan for the number of reviewers we'll need based on the number of applications we can expect. And then I ran a number of new entities in our grants management system. And with the new entities that have registered in there and that don't have a confirmation of intent in there yet, we're about 77. Last year, of course, people might be waiting for end of day, last minute kind of registration. So hopefully that goes up. But last year we had 111 confirmation of intents on our first RFP for reference. And I think we have about 34 new organizations from what I can tell from the registrations in the system and the confirmation of intents. So the word's getting out to new orgs, which is great. And then RFP 3 closes August 2nd. RFP 4, the one that's focused on prevention, providers and health systems and public safety and first responders, opens on August 5th. There'll be another press release that will go out via the AG's office. And then Sunflower will, of course, send out an e-news alert via the communications email and list the information on the website like we have currently, as well as potentially some social media awareness activities to get the word out about RFP 4 when that opens. And that's all I have before we go to Alyssa, if we have any questions.
Questions for Krista? Thank you for the information. Just really appreciate you and Sunflower and how you've been over the top professional and on top of the RFPs, and your processes are above above reproach. So thank you.
Thanks, Pat.
Alyssa?
Okay, good morning. I have a few updates for the needs assessment. So one is data related. So CPPR staff have gained access to IQVIA data. That includes diagnosis, procedure codes, and prescription data as up to date within the last year. And so this IQVIA data provides a new depth of understanding, primarily because it provides access on SUD diagnoses, co-occurring diagnoses, services being provided through the private sector. And so they have access to that, and their team is beginning to go through that, specifically, like I said, looking at those SUD and co-occurring diagnoses and associated services and prescription dispensing. They are as well entering into data agreements with KDHE and KDADS to gain access to similar data that they have, with the goal to compile all three data sources together for a comprehensive analysis of the Kansas system, how it and what it looks like coming through billable services. So that's really exciting. One key piece that they are doing with that is creating GIS maps. And so we're able to, with the end goal being able really to see those visual gaps. And so where are there SUD providers, where are those prescribing MOUD, being able to map resources out. And so while that data is being analyzed and we're hoping to get a really in-depth analysis of what the SUD looks like in the state, we're also hoping to accompany those with visual maps to really understand where things are occurring and where they're not occurring. It is important, I do want to note that data sources are limited to billable services. There are items that have codes that people are, billing for, there's diagnoses that are being recorded. So there is a whole other current work stream being done to learn more about non-billable services that are being provided across the SUD ecosystem. So really understanding what pieces maybe our clinics doing that they know are vital to the success of their clients, but they are not billed, but they go ahead and they do them. What does it mean for us to understand for, we hear stories of people in recovery helping those who need to get to an appointment. They drive them there. We really want to be able to understand those mechanisms of this informal system to really help really understand where can these dollars go? How can we really uplift some of those systems and fill those gaps? So that is a whole other component that will be, what's the word I'm looking for? That will be mapped over each other. So really looking at the formal system, which we're thinking about as this billable data we have, and then this informal system of network and services and just work that's being done that isn't captured there. The second update I have is that we are CPPR and probably me, Sunflower, maybe Krista and some of them, are planning to travel back into communities again and host events. Krista and I are meeting with CPPR later today to determine what the focus of those events will be and where those locations, will be. So we're not automatically going with the locations we used for the Futures Tour. So open to any suggestions or any thoughts from the board today on that. And again, we're aiming to probably within the next week to have the dates and locations identified. And I'll share those with Connie and so they can get to the board, and we'll be doing communications and working really closely with partners we've engaged so far to see if we can get a really good turnout for those. My next update is just that CPPR research team is continuing to hold focus groups and interviews. And so far they've engaged a range of professionals through those, and so a wide range of different providers, so specific to SUD, people who are working behavioral health, working specifically with veterans, specifically in the rural area, as well as peer-led teams, law enforcement, social workers, and that is a continuing process. And so that's been really exciting to see. I know their next two focus groups are going to be focused on people with lived experience, and then a separate focus group for family members who have an individual who either is in recovery or has an SUD. So more to come on those when we have that information. And then my last update is that the next webinar CPPR is hosting is going to be on July 30th. The focus will be sharing recent process and insights that we have learned so far to share with the public, and then seek input from everyone on whether or not what insights we have seen really track with them. Is it really kind of that checkpoint again to ensure that we're really understanding and capturing what people are experiencing from the SUD system. And then it'll be focused again on that future. If KFA dollars are spent successfully and we're able to, through these dollars, create system transformation, what is it that people think that that future will look like? And so they will be doing some work around that during that webinar, and we will be happy to send that to Connie so you guys have that information to share with your networks as you like. And that's all I have for today. Any questions or comments?
Questions for Alyssa? Alyssa, I know we've had this conversation, but I'm saying this for the board members. When they go out on the road again, particularly if any of these meetings would be close to anybody on our board, I would encourage you to reach out to them and use their contacts in the community to try to get a good attendance. What they experienced before, from my observation, and I've had some conversation internally, is that the usual suspects showed up when they were on the road before, and and this will get into the next item on our agenda, but the people we want, not just the treatment centers and the counselors and those people that do this every day and do a great job, but others that really have any intersection with alcoholics and addicts, or we want the primary care physicians and a representative view. We don't need to meet with every physician. We want law enforcement. Again, we don't need every sheriff and chief of police, but to have a few. I imagine the challenges they run into are pretty universal. Veterans, we know of the struggle that they have with addiction, so there's some VA facilities around the state. Perhaps we could get their representation. People that man ERs. I've talked with some different hospital administrators over the years, and lots of addicts present at the ERs that could be intercepted elsewhere. School administrators or counselors. I'm just kind of throwing out a few that perhaps we as a board, if some of these meetings that we have around the state, perhaps we could help get some of these people there. So keep that in mind as you set locations, and please make use of the board to help get as much participation as we can.
Yes, we will definitely do that. And I will do my best to keep the board updated. I am going to be working closely with CPPR to really ensure that we're capturing all these different insights and do a targeted approach. And so thank you very much.
Other questions or comments for Alicia? All right. Thank you very much, Krista and Alicia. And now just kind of our last item. I just wanted to put this out. I know we've talked about this in the past, and just wanted to go over the direction I feel like the board is wanting to move. And please chime in if you have any thoughts around it. But first of all, Robin has agreed to be part of a little work group that will work with the Kansas Health Foundation and also with the Children's Cabinet, a collaborative effort, and then bring a proposal back to us on a project that we could do working together to maximize our efforts. I think the timing's real good. Ed O'Malley, who spoke to the board before, we've had further conversation, and their board was kind of going this same direction. And I guess if I would summarize the direction, it's go big or go home. We've been able to do a lot of good with these small grants, and the entities that we funded has all been good, but feel like we have this opportunity, and the Kansas Health Foundation is kind of at the same point, is what could we do that would really make a difference, that would be a change agent. And that's what's exciting to me, and I've heard most of the board say the same thing. And so the smaller collaboration effort really is going to kind of prove that we can work with other entities, and so very appreciative of Robin and the others from the other entities to put together a proposal for us to consider. But with the information that we'll get from CCPR, and then to just apply our expertise, which we have a lot of it on the board, to be able to take this effort. And just me thinking through this, it's gonna, we might pause on spending for, it might be a year, it might be two, to be able to put together the right RFPs that would really be things that we would fund collaboration amongst a lot of different entities. And I'm just throwing this number out there, but we might give $5 million grants, $1 million a year for the next 5 years to see how a certain, could be a community, could be a county, could be some other effort in a specific locale, but would bring together the more partners. I think we would be look for that and encourage that. So what I thought I would do is, and I've already begun some of this, and I've reached out to some very innovative thought leaders around the nation, just to kind of pull together their thoughts on this collaboration. And I think the more I work on this, there's no end to the different entities that we could pull together. And there's really kind of a effort, as I talk to different entities about wanting to collaborate, wanting to, if we could kind of show them a way, or maybe not as much show them a way, but give them an opportunity in the funding, to pull this together. With that type of money, they could hire a collaboration administrator that every day would be thinking of this, and we have the potential, and you got to dream big, or it won't happen for sure, and it might not happen, but we want to be very intent on our collection of data. If we're asking these entities that we would give these awards to, we would require data dumps monthly or quarterly or something like that. And if it's a 5-year project, that we might reserve the right to change the direction. That if one of our awardees is really discovering something, we'd want the others to maybe adopt that. So, but several people have told me is that the data that we collect could be of great value. If we are actually being a change agent here, not just in Kansas, but doing something that can be used throughout the nation. So something that I hope we have to deal with is the value of that data, both from a monetary standpoint and a practical standpoint. So I just wanted to throw that out there and touch on it, make sure that I wasn't leading us off a cliff. But I believe that I've visited both in the meetings and outside of the meetings, that this is the direction that we look to go over the next few years. So I'll quit there, and if there's any comments or questions, feel free to step up.
Mr. Chair, this is Robert Hutchison from the AG's office. I just would encourage you to reach out to Chris and I to talk about some of this early on, to help avoid that cliff that you mentioned. so we can make sure that everything is good with in terms of the scope of the settlement and the statutory scope of the board itself.
You bet. We'll definitely do that. And Robin, I don't know, your get-togethers, your working group, we will want to, and you can coordinate this with Krista or through the AG's office, that when you start meeting with the Children's Cabinet and the Health Foundation, that we do need to put that information out there if anybody wants to attend from an opens meetings standpoint.
Sure, you know, and Connie knows.
Yeah, just reach out to me and I can help with that too.
Will do.
Other questions or comments? All right, I'll take that as move forward. Keep going. Well, that's about all we have on the agenda. Does anybody else have any comments or questions?
Sure, George, this is Sarah Kaler, and I wanted to circle back around, and I certainly could have missed something here. Where are we at on the education component for elected officials for municipalities? I mean, we are at cities are right at the end of their budget development for next year, and I so appreciate Chris and the entire staff at the AG's office sending, I did request that document that gave us kind of a picture of what we could softly budget in our budget for what would come through from KFAB and pass through to cities. But I know we had also had a time that we had talked about cities and counties and trying to make sure we're educating the elected officials about how this money is to be used, kind of a best practice. Do we know where we're at on that?
So,
Yeah, I can give a quick
Chris?
update from my end. I'm still working on that guidance document. Chris's schedule is pretty hectic, and I plan to get with Chris to at least start the initial review of what that guidance document looks like after, sometimes after July 19th, when Chris's schedule is open a little bit more. And then I anticipate that we would then discuss what are the next steps to get that subcommittee back together and start moving forward. Chris, do you have any other updates?
Just that I think that we would probably be looking maybe mid to late August to do some of that in either remote or in-person training, start that process. What I would say is that the annual report, which all things going well, I hope we can get out very, very soon, will at least give cities and counties a quick picture of what their neighbors are doing, and that'll be helpful. But the target's always been late summer for that particular education information. I think we're still on track for late summer publication of that additional training document and additional training materials. Sarah, the one thing I would say is if there's a city that you're aware of that still needs budget information, please do get them in contact with Nancy and I. I think for everybody's information, we do have information now that we did generate a budget projection for the entirety of the out through 2038 for the entirety of the settlements that we are aware of at this time. That projection comes with a whole list of caveats about its ability to predict the future, especially as we get closer to the out or get further out from the present. But to the extent that you're aware of a city or if you're involved with a county that needs that information, please do have them contact our office. I know a number of them have, but I don't think we've gotten a hold of everybody who needs that information.
This may be something that we just talk about, like when you're not just like have gotten back at 2 a.m. We may want to talk about how we can message that out to municipalities and counties, just so that they know that that document's available. I certainly didn't feel comfortable just sending that out to all cities and saying, hey, send a bunch of emails to Chris and Nancy. So if we can talk about that at some point, so we can make sure we can get that document out to people.
Certainly, and Sarah, I will tell you this, especially for this year. If you want to just tell people to reach out to Chris and Nancy, you're more than welcome to do that. They should all have our contact information and already do reach out to us on a regular basis. So you're more than welcome to do that. Thankfully, after July 19th, my schedule should lighten up. I'm going to be traveling all next week, so I will be in and out of communication. But if they want to reach out to us, we should be able to get that information. So if you want to send that to your mailing list, go for it.
Right, other questions or comments? Seeing none, thank you, everybody, for joining in. And the next meeting is August the 9th, and I'm thinking now that it'll be in person, and perhaps we can put a little more information, meat on the bone, so to speak, on our collaboration efforts over the next year. So pencil that to be an in-person meeting on August the 9th, subject to change. Staff, thank you for all of your efforts and keeping us between the lines. So with that, I will adjourn the meeting.